You know, when you think about modern surgery, all the high-tech gear, the incredible precision, you probably think it's a totally modern invention. But what if I told you that the rule book, the very essence of what makes a great surgeon, was actually written thousands of years ago? Seriously, let's dig into this, because the roots of surgery are way older and honestly, way more sophisticated than you'd probably guess. So listen to this quote: boldness, swiftness, sharpness of instruments, no sweating or trembling, and confidence. I mean, that sounds like it could be posted on the wall of a surgical residency today, right? A perfect checklist for a surgeon you'd want operating on you. But get this, it's from the Sushruta Samhita, an ancient Sanskrit text from over 2,500 years ago. This isn't some primitive, vague advice. This is the actual DNA of surgical excellence, laid out centuries and centuries ago. All right, so before a surgeon even thinks about making a cut, there's something way more fundamental: their ethical code. And no, this isn't some new idea. The ancients knew that the whole healing process starts with how you see the patient. So let's look at that foundation. And this is where it gets really cool. Just look at this comparison. On the left, you've got these ancient Ayurvedic principles: friendship, sympathy, finding joy in a patient's recovery. Now look at the right, modern principles like autonomy and informed consent. It's basically the same idea, just in different words. The core concept that a surgeon's job is built on a foundation of compassion and trust hasn't changed a bit over thousands of years. And if you need any more proof of how seriously they took this, just listen to this line: look after him as his own son. Wow. I mean, think about that. That establishes this incredibly deep, personal duty of care. It's a sacred trust, spelled out thousands of years before we had lawyers and medical ethics boards. This is about so much more than just having good hands. It's about having a good heart. Okay, so we have the ethics down. Now for the next big piece: preparation. You know, a successful surgery doesn't just happen. It all starts with meticulous planning. And that idea, well, it's absolutely timeless. I mean, how direct is this piece of ancient wisdom? Safety is in their hands only, who gives consideration to all the problems beforehand. It's so clear. Think about it. Every pre-op checklist, every team huddle, every single timeout before that first cut, it's all a modern version of this exact same idea. You have to anticipate every possible problem, so you're ready for anything. And today, that ancient principle of looking ahead has evolved into a really critical legal and ethical practice: high-risk consent. It's one thing to get consent for a simple procedure, but when the stakes are high, when there's a real chance of serious complications, the surgeon's duty goes way beyond just getting a signature. They have to make sure the patient truly, deeply understands what they're agreeing to. And this table really lays it all out. For a low-risk procedure, the consent process is pretty basic, but look at the high-risk column. The discussion has to be extensive, the paperwork has to be comprehensive. And why? It all goes back to that ancient idea of considering all the problems. It's about making sure the patient has all the information they need to be a real partner in their own care, not just a passive recipient. Okay, so we've got the ethics, we've got the prep work. Now let's get to the main event, the operation itself. We're talking about the art of the incision, a skill that's been honed and perfected over literally thousands of years. This is what just blows my mind. These criteria for what makes a good incision, they're straight out of ancient Ayurvedic texts. Adequate length, extensible, clean edges, all layers cleanly incised. Seriously, you could use this list today to grade a first-year surgical resident. The idea of the perfect clean cut is anything but new. And they didn't just know what a good incision looked like. They knew how to do it. The incision should be made swiftly in one stroke only. Now, this isn't about being fast for the sake of being fast. It's about being precise. A single, clean, decisive cut does way less damage to the tissue around it. That means less scarring and a much faster, cleaner healing process. That is a fundamental principle of modern surgery, and they knew it centuries ago. But, you know, the moment that incision is made, the surgeon immediately faces the biggest challenge of all, one that every surgeon in history has had to deal with: controlling the bleeding. Hemorrhage, it was, and still is, the #1 enemy in the operating room. And of course, the ancients had a word for it: raktasrava. They understood that rakta, or blood, was life itself. So they didn't just wing it when it came to blood loss. They developed really sophisticated, systematic ways to manage it. This was a science, not a scramble. Just look at how methodical they were. This wasn't just one go-to trick. It was a 4-step process. First, they try astringents to constrict the wound. That's Sondinum. If that didn't work, step 2, Skandhanam, using cold to help the blood clot. Still bleeding? Step 3, Pachananam, using alkalis. And the final last resort option was Dahanam, cauterization, using heat to literally seal the blood vessels. It's such a logical, step-by-step response to a life-threatening problem. So, how have we built on that ancient knowledge? Well, while the ancients were masters of the methods to stop bleeding, modern medicine has added a really deep understanding of the effects of bleeding on the body. This table, for example, classifies hemorrhagic shock based on how much blood is lost, and it links that to specific signs you can see in the patient. So we've gone from knowing how to stop it to knowing precisely how bad it is, which lets us tailor our response in a much more effective way. So, when you pull all these different threads together, what you see is this incredible, unbroken line of wisdom. Now, the tools are different now, our understanding of the human body has exploded, but the core principles of what it takes to be a good surgeon, they've stayed almost exactly the same. So here's the bottom line, right? Patient first, ethical care, obsessive planning before you ever make a move, a constant drive for technical perfection, a calm, systematic way of handling complications, and maybe most importantly, realizing you're never done learning. These aren't just modern buzzwords, they are ancient truths that have been the North Star for healers for thousands of years. And really, it all comes back to this one profound idea from the Sushruta Samhita. Rakta is life. Hence, it should be preserved with the utmost care. That's it, right there. That deep, deep reverence for preserving life is the sacred thread that connects a surgeon from 600 BCE to a surgeon in a high-tech operating room today. Which kind of leaves us with one big question to think about. As surgery gets more and more technological, with robotic arms, AI, and remote procedures, it can start to feel a little distant. So what parts of this ancient human wisdom, the empathy, that profound duty of care, that human connection, what are the things we absolutely have to make sure we never, ever forget?